Welcome to the lecture of the nursing competency that is included in the orientation program of all new staff, trainees, and nursing interns. The objectives of the nursing competency program: to demonstrate continuous competence through structured program, to set minimum acceptable clinical performance criteria, to ensure that competence of all nursing staff are assessed, maintained, and demonstrated, to facilitate continuous performance improvement, and to meet the Joint Commission International and CBAHI standards on staff competency. A competent person performs assigned duties and responsibilities in job description correctly. The meaning of competence is a combination of skills, knowledge, attitudes, values, and abilities that underpin effective performance as a nurse. Competency is the ability to demonstrate knowledge, skills, and attitude to perform a specific job. The process of the nursing competency starts from the hiring process with the interview and review of their curriculum vitae, including their work experience, licensure, and certification. Within the new hire orientation program, the mandatory competencies should be started, and within the unit orientation period of the new staffs, the general and unit-specific annual competencies should be initiated. An ongoing assessment should be done with the following: annual competencies, performance improvement plan, continuous education, individual development plan. Credentialing. The special needs are as follows: transfer, floating, cross-training, modification of services, introduction of new services. The nursing competency program components initially starts from the mandatory competencies. Next would be the general competencies regardless of the clinical unit. Then the unit competencies that will be given to the staffs are depending on the specialty and special procedures where they will be assigned. The ongoing annual competencies will also depend on the performance improvement and education plan of the unit. The mandatory competencies are as follows: disaster preparedness, response to code red, environmental safety, handling of hazardous materials, infection control, handover communication, identifying and managing early warning signs of shock. The general competencies. These are competencies common to all nursing clinical areas: documentation, medication administration and calculation, administration of blood and blood products, care of specimen, pain assessment and management, patient assessment and reassessment, fall prevention, pressure ulcer prevention, oxygen therapy. The general competencies also includes moving and handling patient, ambulance transport, intravenous cannulation, care of vulnerable patient, urinary catheterization, care of nasogastric tube, radiation safety, role of preceptor. Also part of the general competencies are intravenous therapy, wound care management, obtaining and monitoring of vital signs, the use of pulse oximetry, and assisting and preparing for lumbar puncture. The unit-specific competencies are competencies that are unique to a nursing unit or clinic based on the scope of service and practice, job description, and high-risk procedures. Example for the emergency room is the triage. The annual competencies are competencies designated by the management of each unit or clinic based on low-volume high-risk procedure, quality improvement results, and job performance standards. These competencies can be selected from any general or unit-specific competencies. The competency form is used to document assessed competency. The form includes competency statements, performance criteria with the knowledge, skills, attitude. Another that is included in the form is the competency process reference, assessment, documentation, and record. The roles and responsibilities of the Director of Nursing and designee. ensures the competency program is in place and meets high standards of patient care to achieve best practice, monitors and guides the competency program, identifies, reviews, and updates pertinent hospital services of related competencies as indicated. The roles and responsibilities of the nursing supervisor. Participates in the monitoring and implementation of the nursing competency program. Identifies annual competencies in conjunction with low-volume high-risk, quality indicators, changes in practice or standards or policy, and other relevant information events. The roles and responsibilities of the nurse educator and clinical instructor. Initiates mandatory competencies during the new hire orientation period. Provides required education or training programs based on competency assessment outcomes. Reviews mandatory and general competencies periodically. The roles and responsibilities of the head nurse. Ensures identification of preceptors and clinical resource nurses. Supervises and evaluates performance of all nursing staff assigned to the clinical area. Provides coaching, counseling, and develops a performance improvement plan based on the result of the nursing competency assessment. Maintains current competencies on employees' files. The roles and responsibilities of the nurse preceptor or clinical resource nurses. Validates nurses' competence. Communicates assessment findings with the assessed nursing staff and head nurse or supervisor. For the nursing staffs, their roles and responsibilities are to complete the required departmental competencies and promote and provides professional competence in all aspects of nursing care. Thank you for participating in the Nursing Competency Lecture for the Nursing Orientation of the Department of Nursing Services.